Take a moment to think about your own physical activity. Over the past week, did you go for a walk, either for pleasure or to get to work? How long did you walk for? Was it a gentle saunter or at a brisk pace? On how many days did you go for a walk? Over the past week, what was the total amount of time you spent walking or running or playing sport or working up a sweat doing housework or gardening? I begin with all these questions because they are relevant to everyone. I know some of you will know a lot about physical activity, but given the majority of people don't do enough physical activity, I want to begin by talking about some key things that everyone needs to know about physical activity. When you hear or read about physical activity, often the terms physical activity and exercise are used interchangeably. Yes, they are related, but they're not the same thing. Physical activity is any movement of the body that results in energy expenditure. Exercise, on the other hand, is movement that is done with the expressed goal of maintaining or improving physical fitness. And for this reason, it's usually planned, structured, and it's often repetitive. Physical activity makes us happy, physical activity makes us healthy, and physical activity makes us smart. And there's very good evidence that physical activity makes us happy and healthy and smart. Those who are physically active are usually more socially connected, more confident, they live longer, have fewer chronic health problems, experience less cognitive decline, and have better memory. Last year, the World Health Organization updated its physical activity guidelines. The diagram on the slide shows us how physical activity guidelines have evolved over the past 40 years. The 2020 guidelines included several firsts. It is the first time recommendations have been included for people with disability. It is the first time recommendations have been included that discuss sedentary behavior. Being physically active and reducing sedentary time are both important, and they have different effects on our health. The 2020 guidelines is also the first time that no minimum duration of physical activity was recommended. And what this means is that all physical activity counts. Lastly, the guidelines now emphasize the benefits of muscle strengthening for everyone. It is recommended adults do at least 150 minutes of moderate intensity physical activity each week, or at least 75 minutes of vigorous intensity physical activity each week. It is recommended adolescents do on average at least 60 minutes every day of moderate to vigorous intensity physical activity. But being physically active isn't always easy, particularly if you have Down syndrome. People who are more physically active are less likely to have a mental health condition. They are less likely to develop a chronic health condition, and they are less likely to experience cognitive decline as they age. So physical activity is really important for people with Down syndrome because they have a high prevalence of mental health conditions. About a third of young adults with Down syndrome have been diagnosed with either anxiety or depression. They are also at high risk of chronic health conditions such as diabetes and stroke, and they develop these conditions at a younger age than the general population. They are also at ultra high risk of cognitive decline. 80% of people with Down syndrome aged 65 years have Alzheimer's disease. We know adolescents with Down syndrome are about half as physically active as recommended. Most are not meeting physical activity guidelines. And as adolescents with Down syndrome get older, they become even less active. Most adults with Down syndrome don't meet the physical activity guidelines either. Data from over 750 adults with Down syndrome living in the US show only about 13% did the recommended amount of physical activity. To better understand why people with Down syndrome are less active than recommended, we completed 2 qualitative research studies. During both these studies, we spoke to people with Down syndrome, their families, and support people about what helped and what hindered participation in physical activity. The main things that make it harder for people with Down syndrome to be active were access to community facilities such as gyms and sports infrastructure. Access was more difficult because people with Down syndrome said they needed social support to help facilitate their participation, and they had to rely on public transport. Some people with Down syndrome simply weren't interested in exercise. This was often related to previous negative experiences, to having less well-developed physical or social skills, and also to their family circumstances. Competing family responsibilities meant physical activity was sometimes not a priority. There are also some characteristics of Down syndrome itself which can make being physically active difficult. For example, having low muscle tone or being overweight makes movement inherently more difficult. Having an intellectual disability can mean it takes more time to master the physical skills needed. And there can be anxiety around people with Down syndrome being physically active if they have a cardiac abnormality. The main things that people with Down syndrome said made it easier for them to be physically active were having access to social support. Not only did social support provide a social aspect to the activity, but it also meant that the activity had a purpose that was about spending time with someone rather than being about health. Developing a routine or familiarity around physical activity is also important. For example, is the family an active family? If so, they are more likely to be active. Physical active parents have active children. Physical activity also needs to be fun, and people with Down syndrome need to experience success. Exercise is a key health intervention for people with Down syndrome. Note here that I've changed from talking about physical activity, that is the total amount of movement a person does, to talking about exercise, that is planned, structured, and repetitive activity for the purpose of maintaining or improving health. What can the research literature tell us about exercise for people with Down syndrome? Although our evidence base is relatively small, it is growing. 34 randomized controlled trials have been published. Given most published studies are on aerobic training and strength training, I'm going to focus on these types of exercise. Aerobic exercise, for example, walking, swimming, cycling, rowing, increase cardiovascular fitness in the general population when implemented at sufficient intensity, frequency, and time. It's well established that people with Down syndrome have very low cardiovascular fitness. So it's not surprising that aerobic training is the most studied exercise intervention for people with Down syndrome, with 20 published randomized controlled trials. However, meta-analysis of randomized controlled trials of continuous aerobic exercise are inconclusive about the effects of aerobic training on cardiovascular fitness for people with Down syndrome, including relative VO2 peak and pulmonary ventilation. Continuous aerobic exercise does have a positive effect on time to exhaustion, meaning people with Down syndrome can exercise for longer with training. Curiously, when data from randomized controlled trials that implemented any type of exercise training are combined, between group differences in favor of exercise are found for relative VO2 peak and pulmonary ventilation. Lower cardiovascular fitness of people with Down syndrome is in part related to muscle weakness. And this may explain why mixed exercise programs, that is, programs that include both aerobic and strengthening exercise, have a positive effect on fitness, when continuous aerobic programs only do not. Meta-analysis also shows us that aerobic training has positive effects on physical function, as shown by positive changes in the sit-to-stand test, the 6-minute walk distance, and the timed up and go test. Meta-analysis also shows that aerobic training has positive effects on body mass index, waist circumference, and body weight. Aerobic exercise, though, is not easy. For example, running requires prolonged concentration and high levels of coordination. It requires effort, and it can feel uncomfortable if you're not used to the sensation of sweating, which is something that people with Down syndrome have told us that they dislike. Aerobic exercise also has small effects on muscle strength, important for people with Down syndrome whose muscle strength is up to 50% less than people without disability. If we want to target muscle strength, we need to think about a different type of exercise called progressive resistance training. Progressive resistance training gets people to lift high loads a small number of times before muscular fatigue. As a person gets stronger, the load that they lift is increased. That is, it is progressed. Progressive resistance training might be a good choice for people with Down syndrome because the skills are easy to learn, because they are repetitive. It's been shown to be safe in other groups of people with disability, including those with cerebral palsy. And it's inclusive. Everybody doing progressive resistance training trains in the same way, irrespective of whether they are a novice or an elite athlete. When we were designing our randomized controlled trials on progressive resistance training for people with Down syndrome, we emphasized the things that people with Down syndrome told us were important to them. We used a student mentor model to provide the support they said they needed to exercise. So we matched a young person with Down syndrome with a student mentor, and the pair exercised together. This made exercise more fun, and it gave it a purpose beyond health. The exercise program was completed at a community gym that was local to the young person with Down syndrome. This aided participation in the program, and it meant people with Down syndrome were more likely to continue to exercise after the program. The program ran for 10 weeks, which was long enough for people with Down syndrome to get into a routine and become familiar with the setting, but short enough that they were willing to commit to the program in the first place. I've led 3 high-quality randomized controlled trials investigating the effects of progressive resistance training for young people with Down syndrome. These trials show progressive resistance training leads to increases in arm and leg muscle strength, and also to improvement in lower limb physical function. Our largest trial, published in 2013, also found participating in the program helped young adults with Down syndrome maintain their levels of physical activity beyond the program. The progressive resistance training program had effects beyond muscle strength and function. One parent told us that going to the gym was the highlight of her son's day. Another parent told us how it changed her daughter from being a sleepy, emotional youngster to being more alert and happier. Another parent again described how exercise was a way for her daughter to become more independent. Based on the overwhelmingly positive feedback from the Down syndrome community about our research in progressive resistance training, we developed a fee-for-service community-based physical activity program for young people with disability, aged 13 to 30 years, and we called it FitSkills. FitSkills uses the student mentor model developed based on what young people with Down syndrome told us they needed and wanted. It also expanded the application of the model to young people with other types of disability, including cerebral palsy and autism spectrum disorder. We recently completed a large implementation trial with 163 young people with disability, investigating the feasibility of scaling up this evidence-based program, which was published in the journal Disability and Rehabilitation. To finish up, I'd like to talk about how physical activity could be incorporated into daily routines, with some concrete ideas you can use to support people with Down syndrome to become more physically active. I'm going to get you to consider the P words for physical activity. The first P word is preference. Preference is the greatest predictor of participation in physical activity, particularly in children. People often ask, what's the best type of physical activity? It's the one you will do. Ask the person with Down syndrome what it is they would like to do, or consider ways to incorporate the things you already know they like and enjoy into their physical activity experiences. The second P word is people, and I reckon this is probably the most important. We have clear evidence that social support facilitates participation in physical activity for adolescents and adults with disability. Social support is the support provided by available, trusted, and responsive others in terms of either their behavior or the instrumental aid or help they provide. Social support can therefore come from family, friends, peers, neighbors, community, or professionals. Every one of us usually enjoys doing an activity with someone rather than doing it on our own. People also usually prefer to share an activity experience rather than being told what to do. If you want to encourage a person with Down syndrome to become more active, try facilitating by either doing the activity with them or by organizing for somebody else to be their social support person. The third P word is prepare. What skills, either physical or social, does the person with Down syndrome need to succeed in their preferred physical activity? Making physical activity part of a person's everyday routine, starting in childhood, is an important way to prepare them for lifelong physical activity. Investment in physical activity during childhood and adolescence pays dividends during adulthood. Active children grow up to be active adults. And it's never too late to set a physical activity habit. The fourth P word is purpose. Think about why the person with Down syndrome might want to participate in physical activity. It may not be for the reason you think, and it doesn't have to be about health. When we asked young adults with Down syndrome, they told us they participated in physical activity because they got to spend time with somebody or because there was a purpose to that activity. For example, walking the dog. The final P word is positive. For the most part, families know that physical activity is important, but they need to show their child how to make physical activity a priority. It's also important that people with Down syndrome continue to get positive messages about physical activity. And this could be in the form of updates on their progress, showing them the gains that they've made over time. But most importantly, physical activity should be fun, and it's something to be enjoyed rather than always being a hard slog. Our work to increase participation in physical activity and exercise among people with Down syndrome is a team effort. I'd like to finish by acknowledging my research collaborators and our funders.